Today, we will be discussing the 5 most common questions people ask about diabetes. This video will help us answer questions like what is diabetes and how can I be tested for it? What are the possible warning signs and symptoms that your blood sugar level is high? What should I do if my blood sugar is high? What are other medical problems associated with diabetes? And lastly, is insulin injection safe for me as a diabetic person? This video will simplify a lot of questions you have about diabetes, and will go further to provide you with simple tips to take charge of the condition, so do well to stick to the end. And please subscribe and like this video to help it get to more people. You might be saving someone's life by doing so. Now to answer these questions, you need to first understand what diabetes is, and what causes it. Diabetes is a chronic condition in which the body either doesn't produce enough insulin, or properly respond to insulin, leading to high level of sugar in the blood. When you eat, your body breaks down the food into glucose, which is a type of sugar majorly found in carbohydrate-rich foods. The glucose are further transferred to the cells where they are used as energy. The passage of this glucose to the cells require a hormone known as insulin, which is produced in the pancreas, to act as a key to open the cells. When the body does not produce or recognize insulin, glucose builds up and accumulates in the bloodstream, resulting in high sugar in the blood, a condition known as hyperglycemia. To diagnose for diabetes, you can undergo a few different types of tests, with the most common ones being a blood glucose test, which measures the levels of sugar in your blood after fasting overnight. A fasting blood sugar level of 126 mg per deciliter, or higher, indicates high blood sugar. Another important test is the A1C test, which measures your average blood sugar levels over the past 2 to 3 months, and it indicates high blood sugar when the test reads 6.5% or higher. If you have risk factors, such as being overweight, having high blood pressure, or high cholesterol level, or having a genetic or family history of diabetes, it's important to speak with your healthcare provider about getting tested for diabetes. Diabetes can lead to various warning signs and symptoms that can vary from person to person, but you should go for a test if you see the following indicators. 1. Frequent urination. As one of the early signs of diabetes, the kidneys work to eliminate the excess sugar by excreting it into the urine, leading to an increased urination. 2. Increased thirst. Excessive urination due to diabetes can result in dehydration, making you thirsty always. 3. Fatigue. Too much of sugar in the blood can affect the body's ability to convert glucose into energy, leading to fatigue and weakness. 4. Blurred vision. Elevated blood sugar levels can cause changes in the shape of the eye's lens, resulting in blurred vision. 5. Slow healing of wounds. Diabetes can affect circulation and impair the body's ability to heal wounds, leading to frequent infections and wounds healing slowly. 6. Increased hunger. Despite eating, individuals with diabetes may experience persistent hunger due to the body's inability to utilize glucose effectively for energy. 7. Unexplained weight loss. In some cases, high blood sugar can lead to unexplained weight loss despite increased appetite. 8. Numbness or tingling of the hands and feet. Diabetes can cause nerve damage, leading to numbness or a tingling sensation in the hands and feet. 9. Dry mouth and itchy skin. Dehydration resulting from frequent urination can lead to a dry mouth and itchy skin. Diabetes can occur due to various reasons, including poor diet, stress, and inadequate exercise. It is essential to address the presence of too much sugar in the blood, as chronic high blood sugar can lead to severe health complications such as heart disease, kidney damage, and vision loss. Some simple remedies to help you drop your sugar level include drinking water and staying hydrated always. This can help your body flush out some of the excess sugar. Secondly, exercise and physical activity can help lower blood sugar levels in individuals with diabetes by increasing the insulin sensitivity. However, it is important to consult your healthcare provider before starting an exercise program, especially if your blood sugar is significantly high. In addition to regular exercises, you need to be mindful of your diet, avoiding especially foods that contain high sugar, and embracing balanced diets with more fruits and vegetables. Lastly, taking regular readings of your blood sugar, and staying true to your routine drugs is very important and should not be abused. Your healthcare provider can provide you with specific guidance and support to help you manage your condition effectively. Diabetes, when not well managed, can give rise to other complications, and the most common ones include 1. Cardiovascular disease. People with diabetes are at a higher risk of developing cardiovascular diseases, such as coronary artery disease, heart failure, and stroke. High blood sugar levels can damage blood vessels and the nervous system, leading to atherosclerosis, a condition characterized by the narrowing of the arteries and decreased blood flow to the heart. 2. Kidney disease. Diabetes can damage the kidneys over time, leading to a condition called diabetic nephropathy. This damage can cause kidney function to decline and may eventually result in kidney failure. 3. Eye disease. Diabetes can cause damage to the blood vessels in the retina, leading to diabetic retinopathy, a condition that can cause vision loss, or even blindness if not detected and treated early. Regular eye exams are essential for individuals with diabetes to monitor for any signs of retinopathy. 4. Nerve damage. Diabetes can cause damage to the nerves, a condition called diabetic neuropathy. This damage can affect various body parts, including the hands and feet, leading to pain, numbness, and tingling sensations. 5. Skin conditions. People with diabetes are more prone to skin conditions, such as bacterial and fungal infections, due to impaired immune function and poor blood circulation. Insulin plays a crucial role in managing blood sugar levels in the body. It helps to turn food into energy and regulates glucose levels in the bloodstream. For diabetic people, insulin therapy helps open up the cells for easy glucose passage. However, it is essential to be cautious of the following complications that could arise from wrong administration technique. The first is hypoglycemia, a condition where blood sugar levels drop too low. It occurs when too much insulin is administered, or if there is an imbalance in food intake and insulin dosage. And symptoms can include dizziness, confusion, and sweating. Secondly, allergic reactions can be experienced by some individuals, and it can include redness and swelling, as well as itching at the injection site. If this occurs, it is crucial to relate it to your healthcare professional. Another important complication can arise from use of contaminated equipment and syringes that can lead to infections. To minimize the risk of infection, always use a new and sterile needles, and follow proper injection techniques. Lastly, some individuals may experience lump at the injection site due to changes in fat tissues, a condition known as lipodystrophy. It can be caused by repeated injections in the same area or using insulin with certain additives. Here are some safe insulin injection administration tips to follow. First is to consult with your healthcare professional to determine the appropriate insulin type, dosage, and administration schedule. Second is to learn proper injection techniques, and follow the recommended guidelines for insulin storage and handling. The third tip is very important, and it is to use sterile needles and other injection supplies to reduce the risk of infections. Fourth is to monitor your blood sugar levels regularly, and keep a record of your injections as it helps to determine your progress. And lastly, report any unusual symptoms-related side effects to your healthcare provider. In conclusion, taking charge of your diabetes is not as difficult as it may sound. By following the simple steps mentioned in this video, people living with diabetes can considerably live a normal and healthy life. Thank you for watching, and please like, subscribe, and turn on the bell icon for more informative contents.